when I say I try to train parents or patients to adapt to or what they might expect, part of it is I want them to know what differences they might expect between an adult facility and adult-only providers versus what they've been used to in a pediatric facility. And, you know, if I had a choice between being a patient in a children's hospital and a patient in an adult hospital, I'd probably pick the children's hospital. It's fun. There's, you know, there's toys, the therapy pet visits, and so on, and it's just more cheerful. The decor looks more fun. But the thing is there's more expectations on the patients. The adult providers are not used to parents, and so sometimes the parents have to figure out how to introduce themselves in a safe way so that the adult providers are not disconcerted by how involved this parent is. One of the most challenging things that can happen to parents in a transition situation is they may know more about the medical situation and certainly about the diagnosis than the adult providers. For example, and this is an extreme example, that you can imagine a situation where a child is in the intensive care unit on a ventilator, and the parent who has been paying attention and knows a lot about the ventilator settings may have one opinion, and the doctor in charge of the intensive care unit has a totally separate opinion about what the ventilator settings should be. And so the parent may have to figure out, well, how do I deal with this, because I'm trying to look out for the best interest of my child. And it's a hard situation. I have seen that with my own eyes at facilities, and trying to figure out the best way to introduce those things and what the motivations are. Some parents, you know, the end result is that the child, the patient, the young adult ends up being healthy and well cared for. And I should say that adult providers are not as used to the idea that the parent is going to stick up for their child, even if it means arguing with the providers. And so that's a challenge. I think that's a great challenge. I actually kind of like it. I love it when my parents have something to say, because frankly it kind of takes some of the heat off of me, I suppose. And I can say, oh, I hadn't thought of that, and I can go back and do some research and be able to put two and two together. Adult providers are not used to that. That's an unusual phenomenon in adult care.